Our program today is Exercise is Medicine, the Benefits of Physical Activity. I'm Vicki Newell. I manage the Primetime Alive program here at Mary Greeley. As a reminder, if you want to join Primetime Alive, or if you want to sign up for a program or see some of our recordings of past programs, you can go to our website, mgmc.org/PTA. All right, well, we have two presenters today. I'm going to introduce both of them at the beginning, and they're going to kind of tag team back and forth. We have Dr. Greg Welk and Peggy Lockhart, and they're both with the ISU Physical Activity and Health Promotion Lab. Greg Welk is the Barbara E. Forker Professor in the Department of Kinesiology at Iowa State University. His research focuses on the assessment and promotion of physical activity in different populations. He directs the ISU Translational Research Network and coordinates the dissemination of the evidence-based Walk with Ease intervention through both in-person and virtual formats. His portion of the presentation will cover the health benefits of physical activity and explain some of the new facets of the Walk with Ease project. And then our second presenter today is Peggy Lockhart. She earned her PhD from Iowa State University, specializing in gerontology, the study of physical, mental, and social changes in people as they age. She has been involved with older adults through several senior service organizations. She is a certified Walk with Ease program leader and will lead the upcoming in-person groups in Ames and Story City. Her portion of the presentation will cover details about how the Walk with Ease program works for participants. Please welcome Dr. Welk and Peggy Lockhart.
Thank you, Vicki, and it's a pleasure to be here with all of you. So those long introductions kind of sound all highfalutin, but basically what I like to do is help people be physically active. That's what I like to do. So I'm a very physically active person, and I love nothing more than figuring out how do I help other people be active. And you guys are taking a great step by signing up for a talk that's on exercise as medicine. So we'll move into that. And so I'll talk about exercise is medicine, but I'll also mention physical activity. And a lot of you might think, well, isn't that the same thing? And we'll hope to explain that they're related, but not necessarily the same thing, and that the benefits are available to anyone who just does a little bit. So the key is to start becoming physically active if you're not already, and there's easy ways to get started. And that's where the Walk with Ease program comes in. So we'll walk you through a little bit of this. So this is a kind of a rhetorical slide I like to use with students, and kind of you can know what my answer is going to be before you read the question. But what if there was one prescription that could prevent and treat hundreds of different diseases, dozens, I guess? What if there was one prescription? Well, there is, and it's physical activity. It's really undervalued in our society and often by clinicians. Your doctor may or may not promote it as actively as I'll promote it, but there's tons of evidence to support how important it is, not just for the length of life, but also quality of life, independence, feeling good, sleeping better, all these different benefits that help us all. And so the answer is physical activity is the answer to the question, or a pair of shoes. So the notion of exercise being medicine or being really good for you isn't new. It's actually been around by these great philosophers, like you've probably heard of Galen or Hippocrates. I don't particularly know Shushrata, but all these people lived thousands of years ago, and they touted the benefits of physical activity, that it was important for vitality and good health way back then. So it's kind of understood. And now the science has really come a long way, and we know how and why physical activity helps us with health. So the one point here is exercise versus physical activity. So exercise is considered movement that's done for the purpose of enhancing or maintaining fitness, health, or wellness. So if you exercise, you're kind of doing it because you're choosing to accomplish a goal. You might want to improve your health. You might want to get more fit, those types of things. Physical activity is a form of exercise, but it's done without necessarily the same goal or purpose. And it encompasses any movement that you do that's moving around, doing lifestyle chores, working, recreating, those types of things. And you might be, going for a walk, or if you play golf or things like that, you might not count that as exercise, but it counts as physical activity, and it still has benefits. Okay, you guys get the difference a little bit? So I'll walk you through a little bit more than this. And so you see pictures of people golfing, gardening, even cleaning your or cleaning up, that counts as physical activity. And you see a person on a treadmill kind of tired. And our point in showing you that is that exercise might not appeal to you, but physical activity could and should, because it's more enjoyable, doesn't have to be done, doesn't have to be hard, doesn't have to be tiring, those kind of things. All right, so there's different forms of physical activity, and we categorize them into occupational, transportation, household, or leisure. So you might do physical activity in each of those areas, and it's important to think about ways that you can be physically active as a part of your normal lifestyle. You know, just walking into the building here counts as physical activity. Going for a walk on your way home counts as physical activity. Those types of things all add up. And so it's really the accumulation of physical activity throughout the day that matters. So we think about how to promote that in our society. I guess the reason that's challenging is our society kind of engineers physical activity out of our day, right? So we have things that we have garage door openers that open our garage doors, and we all appreciate that. We have cars that move us around. We have suitcases with wheels. We have all kinds of conveniences that take physical activity out of our lives. So the point is we have to add it back in to make physical activity part of our daily routine. All right, so the one point I like to make here is, again, physical activity has amazing benefits for the body and mind. And I didn't want to go into the details here. Whoops, I'm getting a question from Tim.
Go right ahead. I just need to adjust the camera.
Okay. Okay. So the point with, I didn't want to go into the details of how it affects all the different body systems, but basically it affects your heart. Every body system is improved by physical activity. And so I just categorize that to physical, mental, social, and emotional. So it really encompasses all these different areas of health and well-being. So it's not just your physical health, but your mental health and your social health. The curve here kind of shows what we call a dose-response relationship. And the key take-home point here is that you get the most benefits just by starting and doing a little bit. So your risks or benefits are associated with just getting started. And if you do more and more, the level of benefit kind of plateaus. And so that is good news, because that means that to get the benefits of physical activity, you just have to do a little bit. And our physical activity guidelines emphasize that people should try to get about 30 minutes a day of moderate activity a day. So that can be a 10-minute walk in the morning, a 10-minute walk at lunch, and going outside walking your dog at dinner. So 3 10-minute walks counts as enough, or you can add in physical activity and through other forms of, cleaning up the house, gardening, those types of things also count. So that's the goal, but the key point is you still get benefits even if you don't do that. So that's an important curve to know, is that you try to accumulate about 150 minutes a week is where we see the best recommendations. The other point I like to make, and it's another take-home point here, so I often put things in red that are really important, and I like you to think about this, but the human body is perhaps the only machine you can think of that gets better the more you use it. And so most things wear out, but the body gets better. I mean, eventually we wear out, right? But the more you use your body, the better it gets. It adapts and it gets stronger, and it helps improve. Unlike most things that we buy that get worse over time with use, the body gets stronger and better if you use it more. All right, so other key points about healthy aging. So again, a couple key points in red. Physically active people live longer, but that's not the point I'd like to make. The point below that is physically active people age better. And that's the take-home message there, is that it's really not about how long you live, it's the quality of your years and the independence and how you feel. And you guys are all here in prime time alive, taking those steps to optimize aging and to do the best you can. And those are really key steps. So that's what we like to emphasize too. It's not just living longer, it's living better. So this is another quote I like to use, and this is related to the notion of exercise as medicine. So again, I told you, what if there was one prescription? Well, there is, and there's actually a national organization called Exercise as Medicine that champions this cause. And the notion is, if exercise could be packaged in a pill, it would be the single most widely prescribed and beneficial medicine in the nation or in the world. And so that's true. Again, and the initiative that that our field kind of champions is called Exercise as Medicine. And it's a national initiative that is sponsored by the American College of Sports Medicine. But the reason we need a national initiative of this is we need to help people really understand the benefits, right? So even if your doctor is saying exercise, 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 then the patients other people would say, yeah, tell me what I really need to know. Can you make this any easier for me? Tell me what I can do that's even simpler than that. But there's not much anything more simple than going for a walk or putting on your shoes and being outside, being active, right? So that's a funny cartoon we often use in talking about this. So this slide also is kind of humorous in a way, but despite the benefits, people go out of their way to avoid it, right? And this is a real picture. That's not staged. You can go to any escalator anywhere, and this is what you'll see. How many of you are familiar with the Des Moines Airport? So I love that. I tell this story to students. There's 2 escalators on the outside. If you ever see somebody walking up the stairs, it's probably me, because I swear I don't take the escalator. I choose not to, and you guys can too. And I know the convenience of taking an escalator. It's kind of nice, right? It'll carry it up for you. But if that's your physical activity, why not take that stair? Carry that bag. That's your muscle fitness for the day. And so I'm the one that takes the stair, and it's a philosophy that I've chosen, and my kids will even laugh at me. They're like, oh, Dad, I better take the stairs because I know you'll scold me if I don't, or, And so you can be that person and, be a role model and take the stairs. So I like that slide a lot. Okay. So as I've alluded to, there actually is a national and international movement called Exercise is Medicine, and it's championed by the American College of Sports Medicine, which is the leading professional organization for people in my field, kinesiology. And the goal of that is to legitimize physical activity as a vital sign in medicine. And it's still, even though your doctor may talk to you about exercise or physical activity, it's not built in as a vital sign. So we have a person measuring blood pressure here because blood pressure is a vital sign, right? But the point of exercise is medicine is that physical activity should also be a vital sign. And even if your doctor doesn't tell you it is. So it's as important as any other parameter that you can think about, okay? So that's one of the goals of exercise in medicine, and there's actually many health systems that actually do screen and ask patients routinely about physical activity habits so the doctor can counsel and prescribe exercise. And that gets us to some of what we're doing with this Walk with Ease program we'll tell you about. We are trying to let the doctors and physical therapists do the referrals so that we can test this model of doctors and clinicians referring patients into an exercise program instead of us trying to recruit people that are already healthy, right? So if we recruited all of you guys might be already healthy and maybe don't need the physical activity, but we're trying to get doctors to refer people that really need physical activity the most. And so that's one of the goals. Below the exercise, the official logo, you'll see our local campus one, and we like to spell things with psi whenever we can. So we spell it Exercise is Medicine. And so some of you might have heard of that organization, but we actually have a great thriving campus group. So a lot of the students that I work with really help carry out the Walk with Ease program that Peggy will talk to you about. And so they offer health coaching, they sponsor things on campus, they sponsor 5Ks, they do things on campus, but the exercise time and Walk with Ease are at the bottom. Exercise time is an effort that we promote physical activity for kids in schools. So we exercise with kids and have college students promote physical activity with little people. And we also offer Walk with Ease for people in your age group and try to help everyone. So the students are key parts of that program. And so here you see some logos and some of the student leaders about how Exercise is Medicine works. And the logo or program we'll be talking about here today is called Walk with Ease. And I think that's where I'm going to turn it over to Peggy. So I think this is where we're going to transition, or one more. All right, so our team, this is our website. And so if you want to learn more about Walk with Ease, you can go to walkwitheseisu.org. So we actually serve as the state hub for this program across all of Iowa. So we've been building this program actually before COVID. We had an in-person program and then COVID hit and we had to adapt and make a virtual program. And so we learned how to deliver Walk with Ease across the state. Now we were able to add our in-person program back starting about a year ago actually. And then we've kept up our virtual program. So now people have choices. But we'll be talking to you mainly about our in-person program. I'll turn it over to Peggy.
Okay. Thank you very much. So what is Walk with Ease? What does that mean to us and to you? This program was originally developed by the Arthritis Foundation, and it was meant for older adults to learn how to manage how they're moving and how to alleviate some of the symptoms of arthritis. It emphasizes regular activity. And as Greg said, it's available in a self-directed group online or the group versions that are in the community right now. So basically, it's a 6-week program. It comes with a guidebook, very helpful guidebook, talks about the lessons and gives you weekly reminders about things you should be doing. The goal of the program is to build up to at least 30 minutes a day in exercise at least 5 days a week. And so that's what we strive for with those that are in the program. So what's in the program? Well, as you go along, especially in the group program, you get tools and strategies about how to keep motivated, to keep moving, and how to do some of your exercises. We also do stretches before and after the walking session. So we also give you those, plus we give some strengthening exercises, just in case you may want some of those. We also have weekly informational, educational handouts and information about arthritis or about how to manage your symptoms and why exercise? Why? What does it do for you? And so we have plenty of information that we give out during our program. So if we had people here that have been in the program, they would tell you that they feel better after being in the program and completing the program. Also in the community type programs, they like getting together after a while. They like seeing each other. It gives them, it makes them want to come to walk because they do walk together and talk together. And so that's really beneficial to them. And they do see differences by the time the program is over. And so it's been very beneficial to them in many ways. And you'll see that if you were in the program. So what does evidence suggest? Walk with Ease is an evidence-based program. That means that research has been done about the program that actually proves that it does do what it says it's going to. And so there's been numerous research facilities that have done research about this program. And so it is definitely showing that it does do what we say it's going to. Not only that, now Walk with Ease is also endorsed by CDC, the Centers for Disease Control and Prevention, as one of their lifestyle management programs. And you can see that on their website. So right now, Walk with Ease is being delivered locally, and it's in collaboration with ISU Exercise that Greg told you about earlier. Currently, we will have 2 Story County locations, one downtown at the Ames Community Center and one in Story City at the Lifetime Fitness Center that's associated with Mary Greeley. And all this program will be led by ISU students, and I will be the program leader leading the actual group every week. We're going to give you a little glimpse, hopefully this will come together, of just what the program entails. This is a past program that took place in Ames.
Those of you who are newer, this is our Wednesday starter that we'll talk about kind of some educational information, and a lot of this stuff is talked about in that book that you have. try to get to know them, and they want to know why we do a warm-up, why stretching is important, why do we cool down at the end and do more stretching. I think a lot of them could testify too to say how much better they feel as they've been walking and how the moves, and it doesn't matter the age, but to keep moving as we get older, and the more important it is.
If you want more information and you have access to the internet, you can certainly go to Iowa State Walk with Ease. If you can go to Iowa State Walk with Ease, and that's also where you can that you can do registration by just the click of your mouse. It's easy and quick, and we want you to go out and tell all your friends. Okay, now Greg's going to talk to you about more of a new program that's coming up using Walk with Ease and a CDC grant.
Yes, that's fine. So yeah, this has a little bit more information of what Peggy was mentioning, that we have programs in Ames and Story City, and we're going to run those as part of a formalized research study that we have funding now from the CDC. So our work was impactful, and we were able to demonstrate that it actually has some really powerful effects on fall prevention. So the last half of the talk, I'm going to cover how physical activity and Walk with Ease relates to fall prevention. And if you're interested in that area, then you may be eligible for this trial. But we actually are going to continue offering our base version of Walk with Ease in the ISU Exercise Clinic. I don't know if some of you have heard of that facility. Some of you. So it's a great campus resource. It's right in our Forker building, and we're going to offer our standard Walk with Ease there for people that might not qualify as being at risk of falls, or if you're just interested in the base version of Walk with Ease. And again, we have the virtual version as well. So by clicking the link on the website, you can access any of those. So this is the new project. So we showed press releases. So the press release in January talked about how we're starting this program, and we were fortunate again to have sufficient data and to apply for a grant from the CDC. And this is a new press release that says CDC grant spurs research for fall prevention. And so we're actually getting ready to start that trial right now, or in a couple of weeks. And we'll be enrolling people and signing people up. We've actually got a waiting list of people, so we're excited. The buzz has gotten out and people have heard about it. How many have heard already about Walk with Ease? Any of you? You might have gotten a mailer even. So we've started promoting it, and we're happy to, again, share it here. So I guess this may be another video, but I don't think that would show. So if you're on our website, or if you just Google Walk with Ease ISU, you would see kind of comments from one of our participants. So I wanted to cover how Walk with Ease relates to fall prevention, and this is an important topic for all of you as well. So we'll mention this, but frailty is one of the most common and most modifiable risk factors for falling. And so frailty is what happens when you aren't physically active. It's a natural process that if you're not physically active, your body doesn't hold on to all these great benefits, and it'll become more frail. If you're physically active, you can reverse that and have more robust health, better bones, better muscles, stronger fitness, better heart. All those different things will improve. But frailty kind of captures the general decline that happens with age, but again, it's largely modifiable. So I wanted to use these slides, and these are intentionally in big red letters to kind of scare you. No, not really. But actually, these are Dr. Kitchell's slide. I don't know if some of you know Mike Kitchell, but he and I co-presented during a Grand Rounds talk here in Mary Greeley, and he covered kind of the issues, the neurological issues about falling, and I just borrowed some of his slides in some of my talks. But these are really important to know. Like, how frequent are falls? Well, too frequent. Every 20 minutes, an older adult dies from a fall. So not directly from the fall, but from the long-term consequences of falling. So 3 million Americans were treated in emergency departments for fall injuries. And so Mary Greeley actually was part of the process of getting Walk with Ease going here, because they contacted me about a year ago and said, Greg, do you know anything about any programs that might help older adults and help us stem fall prevention? I said, well, yeah, I do know a program, and it's one we're leading. So that kind of conversation started from the doctors leading the emergency department trying to stem the local climb in falls in Story County. And so we had that program running, and we were able to offer it in partnership with Mary Greeley and some of the physical therapists, because they it's a mutually beneficial partnership. They want to reduce falls, and so do we. So, but again, falls are way too frequent, and we're trying to do something about it. And these are some other statistics. 29% of people over the age of 65 fell last year. Almost half of them had 2 or more falls. 37% needed treatment or decreased activity as a consequence of that. So that's what we want to avoid. So again, these are kind of alarming, but they're important for you to be aware of, that it could happen when you're not expecting it. So you have to kind of move slower, think carefully before you step on ice. And I'm sure you guys do this kind of routinely, but it's just good for all of us to be aware of the risks. So bad things do happen when you fall. So again, 800,000 admissions per year from falling. 20% who have a hip fracture died within a year. One statistic that maybe people aren't familiar with is actually, you've heard of people falling and breaking their hip, but you might not be aware that people actually break their hip and then they fall. So your hip can actually break while you're upright walking, and that causes you to fall. So both things happen kind of in both orders. And so your bones can get so frail that your hip will fracture, and then that causes you to fall. But you couldn't maybe tell which was happening first, right? So these are really important statistics. But again, fortunately, these are largely preventable if you're taking caution and building up your fitness. So prevention is better than treatment. And so this is what we try to emphasize in my area of work, which is health promotion. I don't deal in the recovery or the treatment side. I deal in the prevention side. And so this is what the CDC recommends. So the reason they kind of were interested in our study is they have this very established program called STEADY, Stopping Elderly Accidents, Deaths, and Injuries. And they have a very refined process of screening, assessing, and intervening. And so the screening and assessment can happen from your doctor or a physical therapist that might identify that you have risks of falling that you didn't know about, that your balance might not be so good, and that you could be referred to an evidence-based program. And that's where our Walk With Ease program comes in. And so one of the assessments that we actually do in screening, I'll even demonstrate myself, is you have to be able to stand on one foot for like 10 seconds without tipping over. And I'm not even so good at it, right? But I'm willing to bet that some of you wouldn't feel very comfortable doing that. Am I right? And so the ability to stand on one foot, you can improve that with physical activity and balance exercises, some of which we offer in our program. And so again, I could have fallen right there. I was taking a risk, but my balance isn't so good either. So I can appreciate that it's something we all have to work on regularly by stretching and strengthening our body. But the point of Walk With Ease is we provide that 30 minutes of walking as well as stretching and strengthening exercises to kind of reduce your risk of falling. So our strategies and interventions are the same as screening, assessing, and intervening, and you guys could do this yourselves. You guys could think about, am I at risk? What should I do to improve that, and intervene by taking proactive steps and becoming more physically active. So these are some of the risk factors we mentioned for falls, and I'll just be complete by telling you there's a lot of different risk factors, right? So it's not all within your control, but frailty is the leading one, and it's not just, again, aging, but there's gait disorders, Parkinson's, other neurologic disease, orthostatic hypotension, disease, vertigo. So there's other clinical conditions that you could be at risk of or have, and your doctors would help you. Actually, medicine, too many prescription medicines actually increases your risk of falling. So there's a lot of efforts by the CDC to demedicate older adults, to have you take less medicines, even though some of those might be really important for you. If you take too many, they actually compound each other and kind of increase your risk of certain things. And so your doctor, again, would help you know what's right for you. So again, I like to emphasize, which one of these do you have most control over? Well, probably not many of these, but you do have control over the top one by choosing to be physically active. And so this is what frailty is defined as, a condition of being weak and delicate, and it's a clinical condition. Frailty is known, it's defined that way. Age is a risk factor, but again, it's modifiable. It's not always predictive of a person's frailty. And so what you want to be is as healthy and fit and functional as you can for your age, and kind of defy aging to the extent possible. So again, we like to point out that frailty is largely preventable if a person adopts and maintains regular activity throughout life. Arthritis may lead to frailty, but other things like gait and balance contribute to it. So one of the reasons that the Arthritis Foundation supported and developed Walk With Ease is because arthritis is one of the leading conditions that affects almost all older adults, and it can lead to falls through frailty. All right, so these are some strategies, again, you can use to reduce risks of falling, and some of these you've probably heard of from therapists, doctors, home health nurses. First, to create a safer home environment. So maybe you haven't thought about this, but you want to remove clutter, rugs that kind of get in the way, because we can trip on those. So, you want clean, grippable surfaces. My parents had this really slippery staircase that went downstairs to our basement. It was like varnished wood. And I kept telling my parents, you've got to put something on that. And finally they did. So you can easily get this little grippy traction. So now going down the stairs, it's a lot safer for them and me going downstairs. So there's simple things you can do, but it took me 10 years to probably convince them to put this grippable stuff on your stairs. So don't let that happen to you. If there's things you could do, take action. Just get somebody to install it if you don't want to do it yourself. But there's really simple strategies to avoid risks. So again, non-slip mats is what I was highlighting there. Use good footwear, minimize exposure to slippery surfaces. How many of you know about, I think they call them yak tracks that you can put on the bottom of your shoes? I have a pair. They're really nice. And so you can just, anytime you're going outside in the winter, just have them on your feet, and they're like little studded tires for your car that help you reduce risks of slipping. So any of those are strategies. Again, you want to review medications with your doctor. I mentioned that it is potentially could exacerbate conditions or complicate risks. But the last one we like to focus on is physical activity. So this is what we've highlighted as the benefits of physical activity. It increases your mobility, reduces fatigue, increases independence, reduces arthritis pain, improves quality of life. So again, I could go through and probably come up with 10 more things that it does. But what we want to focus on here is with regard to fall risk, is this is a cycle that tends to happen in older adults, is they might have an increased fear of falling. That leads them to become less active. And if you become less active, your function gets worse, which increases your fear of falling. And then that cycle keeps getting worse. And you see how that would kind of perpetuate itself in that direction? So what physical activity, what we try to do is reverse that cycle. So by being more physically active, you improve your function, you reduce your fear of falling. That helps you be more active, move around in your environment more, go to the store more, go outside more, interact more. And the more you do that, your function will keep improving. And so not just physical function, but cognitive function. So you want to reverse that cycle and maintain your independence. And so that's where activity helps break that cycle. And that's kind of what Walk With Ease is about. So I guess that's all we have for you. We hope you enjoyed the talk. Maybe it's time for a stretch break. So maybe before you guys get into questions, I'd encourage you to stand up briefly and take a stretch break, and then we'll have time for questions.
Yes, we'll do questions, and let's see if there's any online. Quick.
Where do you get the strip stuff? What's the name of it for steps?
Oh, it's a strip.
What?
I didn't hear the question.
What's the name of the strip and where do you get it?
Oh, a tread strip. I guess I have to look. It's probably available at hardware stores. It's probably just rippable.
Is it just along the road? You cut it?
Yep, you cut it.
And how wide is it?
It's stapled. It's really thin. It'll be no thicker than
Thin, but I mean.
Everybody at
how wide?
home,
Step wide?
if you have questions, please type those in. We're taking a little stretch break here. We'll just get started here in a minute. But if you have questions, go ahead and type it in, and we will get to those. Here, well, I think we're gonna get started. So in the room, if you have a question, raise your hand. Oh, there looks like there is a question. You gotta read
Yeah,
the question
I
and
can.
then.
The question is Walk With Ease a one-time program, or can people continue to do it again? That's actually a great question. So Peggy kind of alluded to this. So it's only a 6-week program, but we had many participants stay on, and they kept walking, and it created a small subculture and a club of sorts that we've had many people continue walking over time. Our challenge is that we run out of room, but we have had such a good response from the Ames Park and Rec Department that they're going to be offering free walking times, or I think you might pay $1 a time or something, but you can go to the Ames Community Center from 8 to 9:30 on Monday, Wednesdays, and Fridays and just walk. And so we've created that. We helped them spawn a separate walking time for anyone in the community to go walking indoors. And so a lot of our quote graduates that have done Walk with Ease will be going to that session, and you guys could as well. So you can walk on your own or with friends indoors at the Ames Community Center. So I'll have to verify that with Nancy Shaw, but that's my understanding is that they opened it from 8 to 9:30 on Monday, Wednesday, and Fridays.
And do you have to have like a membership there?
No, I don't believe so. So right, I think they were trying to make it free. I'm not positive if it's free. It might be again $1 a day or something like that, or you can get a membership. But
Okay. All right.
Oh,
Yeah.
let me come at the microphone so everybody can hear.
My question is just going to bounce off before you started. And then that 8:30 to 9:30 time
Yeah.
is early in the morning. What about people who don't like to get out or when
yeah,
the weather's worse early in the morning?
yeah.
Do we have anything being offered for mid-time?
Well, our Walk with Ease sessions are at 11 o'clock in Story City, or 10 o'clock at Ames, at our exercise clinic, 11 in Story City, and then 1:30 back in Ames. So their formalized sessions are at 3 different times. And again, the only time the Ames Rec or Community Center had available was 8 to 9:30 for free walking. I wish our community had a track, and up in Story City, they have a beautiful track in their facility. Ames does not really have that facility at the present time. I think they're going to try to build that into the new pool. But I think
You can go to the mall.
mall walking.
The
mall-
walking's a nice option.
Mall walking
Because
is a good
that's in the
option.
morning, But it's up until.
Well, you can walk in. You can
anytime.
walk
Yeah.
anytime.
Yeah, the mall is a good option.
Yeah.
Yep.
Oh, Menards.
Did somebody have a question on here?
So just to explain again, we talked about the program for falling at ISU.
Yeah.
There's a different program than the one at the community center.
Yeah, that's a good question as well. So the question was the type of program. The one for fall prevention is basically our new version of Walk with Ease. Because it's run as a CDC trial, a funded trial, you have to be eligible. And so if you're not determined to be at risk of falling by a therapist or a doctor, then you might not be eligible for that. If they conclude that you are eligible, then you could enroll, and we would guide you through the Walk with Ease program. And as part of that visit, we actually have the participants would get a visit by a physical therapist, and that therapist would help prescribe exercise specifically for you. And so that's something we've been able to add to Walk with Ease to further enhance it. But that, again, is only available as part of that clinical trial. But our base program is available to anyone that's over the age of 60 and that wants to, just be physically active. So you don't have to qualify for anything other than age.
I already go to the exercise
Yeah.
clinic at Bob Porter on Monday, Wednesday, and Fridays. I've been doing it for several years.
Great.
and working with it.
Great.
But looking for something on Tuesdays and Thursdays. Can the Walk with Ease be just 2 days a week for you, or?
That's another good question of and we've had that, our program is anchored to kind of Monday, Wednesday, Friday, because it's convenient for, to deliver it in a standardized way. But I think you raised a good point about whether we could offer something on a Tuesday, Thursday as well. So I don't have anything right now that's available, but we can talk to Anna Fantini, who runs the exercise clinic, and see if there could be extra times for walking available there at least. And maybe with Nancy Shaw, her program may be available daily. Yeah, so it may be every day at 8 to 9:30. I'm not positive of that, though.
I would just like to strongly encourage everyone that's here. I am 82 years old. I go to Planet Fitness 3 times a week, and I walk 2 miles a day,
Great.
6 days a week. And I've been doing the walking for over 40 years.
Yeah.
And you don't have to walk the mall. I mean, you can. It's open. You can go in the summer and take different. I'm not discouraging your program at all. I'm encouraging it because I know how I feel. And
Yeah.
I'm very healthy.
That's fabulous. That's what we like to hear, and that's why physical activity is so important. And I think most everyone can attest that they do feel better when they walk, and you just need someone a little bit of extra motivation and maybe accountability, and that's what Walk with Ease does. Is we help get you started, but then what we teach is also the skills that you need to maintain that over time, like how to set goals, how to remind yourself, how to get social support from others, how to find places to walk. And so we'll build all those skills so that you can continue after the 6 weeks.
Right, and if I could just mention too,
Microphone.
Walk with Ease is really set up for any level of fitness. So that means if you're just starting out, we can still, you go at your own pace, and we just give you information and monitoring so that you can get more up to speed. So that's what's good about us. You don't have to be a daily walker to come and join.
Park and Rec has really good programs for older adults.
Yep.
I do one as a stretch,
Yep.
strength, and balance that's really good. And you can do any level really.
Yep, sure.
If you want to. And I do what I call old people Zumba.
Mhm.
So that's fun. And Nancy Shaw is wonderful. She
Yep.
will help you find things.
Yeah, they do offer a lot of programs. So in Story City, for example, they have a thriving Silver Sneakers program. If you're not familiar with Silver Sneakers, that's fabulous. But we often view that Walk with Ease might prepare you so that you can be more independent, so you can get to the gym and do it on your own, or so that you can join Silver Sneakers or do these other classes. So we take anyone at any level and kind of help you build up to the skills and fitness that you need to kind of continue. Yep.
Just one second here.
You mentioned Silver Sneakers in Story City. Is there one in Ames?
You know, when I brought that up, I'm not sure.
I am not, is there one?
Yeah, there is
Parks and
one.
Rec
Yes.
also?
Yes.
So I just don't know the times and details, but we've been interacting with the Story City group up there, and there's maybe 50 people that were there in the gym that day we were there, and so I don't know the times of when Silver Sneakers is offered here.
We could learn about that from Park and Rec.
Yeah. Nancy's going to get a lot of phone calls tomorrow.
Can you give us the number?
Yeah, Vicky can.
Yes, I can get the number for you. And you know what else I wanted to say? I know not everybody is as comfortable on computers. For those that are here in person, if you want to sign up for Walk with These, I'm happy to stay here afterwards and
Yeah.
we can sign you up.
Yep, that'd be fine. We could also, give Vicky the information. She can forward that on. Yeah, or write your name down.
Sign up your website, right?
Sure,
And-
yeah. We can help, or we can take a interest, or just name an email and we can contact people.
Unfortunately, Social Security or Medicare does not have a benefit program for exercise. But some of your supplemental insurances or Medicare Advantage will help pay for gym and membership. if you,
Right.
would like to.
Yeah, that's a good point. And that's where Silver Sneakers comes in. With certain providers, it can be covered.
All right, any other, I'm glad somebody brought up Parks and Rec, Judy, about doing stretching and balance and stuff, because that's what I was gonna say. I think walking is great, but I think some people, would like maybe a more of a whole approach to physical activity and whatever, and what are the options? It doesn't sound like through your program necessarily, but it sounds like Parks and Rec. And do you have any other suggestions?
Well, I was going to point out, though, that our project Walk with Ease does include stretching and
Right.
strengthening. So the general format, we didn't really go through it, is it's an hour, 3 times a week. There's like 5 minutes of gathering time and it's kind of a warm up. And then we do 10 minutes of stretching and strengthening. Then we do 30 minutes of walking, and we actually change direction. So you'll go 15 minutes in one direction and 15 minutes in the other to kind of balance yourself, right? And then you do 10 more minutes of stretching and strengthening. So within each hour, you're getting 25 or 20 minutes of stretching and strengthening, 30 minutes of walking, and a little bit of socializing along the way. So yeah, we do cover quite a bit of that in our program. But then our recommendation is to do those same exercises on your own at home, in your spare time on Tuesdays, Thursdays, Saturdays, and so you do something every day.
And maybe I was not paying attention at that moment, but is there a fee? And
Nope.
No.
Walk with Ease is free, so we're able to cover all the costs for Walk with Ease. We train the leaders, and we deliver a very standardized program, and so it's all for free. It is a research study, so as part of enrolling, then we ask you to fill out surveys and help us evaluate the program and tell us what you like and don't like. So it's run as a research study.
How is the parking?
Oh, somebody asked. how
Yeah,
to park.
the parking, that's one of the reasons we do this in the community. So we have been running it in the exercise clinic for years, but parking on campus is difficult, to say the least. So at the Ames Community Center, there's plenty of free parking. It's kind of on the western side of the building. There's plenty of free parking available, and it's right in the main gym. In Story City, they also have free parking up there at the Story City Fitness Center. So parking is available in both buildings and for free.
Where is it in Ames, the free parking?
It's the Ames Community Center. There's free
And
parking.
they've taken away the free
No,
stuff, I think.
there's I park. You have to go to the western edge of that parking lot. It's free. City Hall. But on the west side of the building, it's free.
Yep. All right, another question here.
Not another question, but check your insurance because I go to Planet Fitness and I do the $10 a month and it's free by my insurance.
Wow, see, that's great. And that's where your doctor might be helping you have documentation that you need to file with your insurance. That's really good.
I'm curious how the physicians responded to your program when you talked to them. Is there any evidence that more doctors in town are doing more prescribing of exercise?
Yep, so the question was about doctors and clinicians prescribing and referring. And yes, we're moving forward in that direction. So the physical therapy department here at Mary Greeley is very involved in helping us screen. So we'll be offering free community fall screens throughout Story County over the next 3 years as part of the trial. And so there you would get a physical therapist to administer the formal official fall screen that's administered by the CDC, and they would help you determine what your needs are. Maybe you qualify for physical therapy because of that, or maybe they would refer you into Walk With Ease. And so as part of that program, we envision that a number of people would be eligible for Walk With Ease from the referrals. But we also work with McFarland, and many of the doctors here on staff are very passionate about helping. So we're trying to make that really easy by making it so that they can click a button in the electronic medical record and directly refer you. So we're working on those things.
We did last spring or summer. We kind of had to kick off a little pilot for them with our physical therapists here. For those of you who came in this room, we did fall and balance screening. We were able to do about 45
Yeah,
people.
that's right, with Matt.
Yeah.
Yep.
And then it was great because it was kind of, the sheet that they did the evaluations, and right on there, they marked what their recommendations were for you, whether referring you to physical therapy, referring you to the exercise program, or some people, they suggested they needed to go see their physician for different reasons. But it did provide a lot of wonderful information and then gave people a direction on kind of where to go. So, and I know they're kind of facing, and we're working towards this 3-year coming up, and I would not be surprised if we might offer again this year as
that'd be
well.
a great thing, great place to start right here in the building screening.
I do not see any more questions online. Any more questions here in person? Okay, so I have just what your opinions are. People come. What about walking shoes? What do you suggest? What?
That's a good question. So I think, if you trust a person at a shoe store, they should probably get you into the right type of shoe, but it should be a walking shoe. We often tend to think of, they're tennis shoes. Well, tennis shoes are maybe for tennis. Running shoes are for running. Walking shoes are for walking. And so there are differences between a walking shoe and a running shoe, and between a loafer or another shoe. And so I would recommend a nice, sturdy walking shoe that's made for that. And I don't know a brand in particular, but every company makes good walking shoes, but look for that to be in the name of the shoe, that it should have good grip and traction. And one of the advantages of offering Walk With Ease in these buildings is it's on a really nice, smooth surface. You don't have to worry about cracks in sidewalks and slipping, and so some of that is really nice indoors, and so they're just a good indoor shoe is good. Good question there.
Let me come on over with the microphone.
In the current program, are there any people walking with walkers?
Yeah, that's another good question about walkers. So you can use anything you want to walk. Actually, the group that we coordinate this program with, there's a nonprofit based out of Des Moines that's called CHP Community, and the woman there is a leading advocate for pole walking. And so pole walking is when you've seen people walking with poles that have little tips on them, and you can get tips that are rubber for walking indoors, or for almost like a ski pole to give you grip if you're walking outside. And so walking with poles is also a good idea, but you can use a walker, cane, anything you would like. And we even set up chairs throughout the room so that if you get tired in the middle of a lap, you have somewhere to sit down And so it's perfectly fine to use whatever support you need.
I was going to ask you about heart rate monitoring.
Yeah.
You looked at me the wrong way. Heart rate monitoring and heart rate benefits versus low, moderate exercise versus extreme exercise.
So that's a good question about heart rate. So walking is, again, probably the most popular and most beneficial form of physical activity because it has low impact, it's easy on your joints, and you get almost all of the benefits that are from physical activity from walking. If you want more benefits, some people like running or jogging and getting their heart rate into a higher zone, and that's a personal choice. But you don't have to do that to get the general health benefits from physical activity. Walking will give you almost all of them, or any other recreational or light form of physical activity.
Okay, so a lot of times we have programs from different types of wellness professionals, and it's always interesting, and I'm kind of curious to hear what your answer is, because I'm guessing it'll be the same. People will say, what's the best exercise?
Yeah, the one you do.
The one you do. That's what I'm looking for.
That's it. The one you do. Yep.
Yeah. So, all right. Any other questions here in the room? Oh, over here. 1 second.
There's a Dickies exercise.
There he is.
Is there anything that would disqualify anyone so they couldn't purchase?
Or that would disqualify you? So in the program, anyone can sign up for Walk With Ease. We have various research studies that allow you to be in certain protocols, let's say. So the general program we have is available to adults over the age of 60. I think that would capture most of you. So just guessing. But so 60 and older is one age requirement. And then the other is you have to be able to stand without increasing pain for 10 minutes. So we do want to make sure that you can stand and kind of be on your own and not feel worse for 10 minutes. That is a screener that the Arthritis Foundation actually recommends for anyone doing Walk With Ease across the whole country. So that's up to you to decide if your pain increases and you can't stand comfortably for more than 10 minutes. So that is a screening tool. And that might mean that you have to build up to even doing Walk With Ease. So that's the only inclusion criteria, really, above 60 and being able to stand for more than 10 minutes without increasing pain.
All right.
And one more question over here.
Where is there? Oh, all right.
She's been good. She wins the prize. She's got 3 questions. He's only got 2 back there. So. Yeah. Her name is Trina Radsky-Suchan. If you search urban polling, it's a specific type of poll. So she offers, it's called.
My question is different from that.
Yeah.
My question is, if there were a walker,
yeah,
a person using a walker trying to enroll in Walk With Ease, if they could not stand for 10 minutes without their walker, would they be disqualified?
Yeah, that's where we rely on a physician to decide. So we have, because they're research studies, we require a physician to say you're safe to exercise. And if the physician says it's a good idea and they approve of you being in the program, then we do as well. So it's not our decision, it's really the doctor's opinion of your safety that we think is most important. So we would enroll you if the doctor provides, approval for you to join the program.
So really, if anyone's interested, no matter what condition you're in, you should make that initial contact, come and have the evaluation, which will probably give you good information. And then you'll find out if you need that. Well, you will. Everybody needs to sign up by the physician.
We actually either, in our past trial, we had people have to find that on their own, and many of you might be able to call your doctor quickly, but it's also kind of inconvenient. But we're working with our process is such that if you click the button and enroll, somebody else will call you and fill you in a little bit more about Walk With Ease, and they would offer, if you are eligible, to help you get that permission from your doctor. If you tell them my doctor's name is so-and-so and they're at McFarland Clinic, they would call them, handle the permission for you, and then you would be referred back to us to enroll in the study.
Okay, where did we start?
One second. We want to get this on so people online can hear what the question is.
You just said we should fill out a form or something. What's that first step?
It's online. It's a clickable link on our website, but we can make that possible for you
Yes.
to
What's the website?
walkwithisu.org.
And I'm happy today when we're done, if anybody wants to stay after, we can hop online here and get people signed up
Yeah.
if that's easier, if it's not something you're comfortable
And we could
with.
take list of names and email you as well. But again, we have a phone number on our website, so it's just hard to get our information to you. But Vicki knows where to find me.
Also, when you sign up, you told us it was at 10 o'clock and 1:30, I think, here in Ames.
Right.
And that's Monday, Wednesday, and Friday
Yep.
for 6 weeks.
Yep.
Okay, at 10 or 1:30. Okay.
Yeah.
And when's the
But
next
no,
one?
11 is the time at Story City. So-
Yeah, so 10 and 1:30.
Yeah.
Right here, right, okay.
But no, she had it right.
Only at 1:30.
Oh, only at 1:30.
That's the Ames Community Center version is 1:30.
Oh, okay, okay. All right.
And what about the one at the university?
That's at 10 on Monday, Wednesday, and Friday.
And it's the same program, so you can
It's
go to one or the other.
Well, once you enroll in one, you would stay at that
Well,
one,
yeah,
and then
but I
yeah.
mean, time-wise, you could go to ISU, that's the Faulkner building.
Forker, yep.
And then the other one is
Is at Ames Community Center, yeah.
At one.
The two programs are slightly different because the fall prevention trial is the one in the community. The one in the exercise clinic is one that does not have the same, you do the same program, but you wouldn't get some of the same treatments by the physical therapist. So there's a couple slight differences.
Now, say that again. Which one was the program you were just talking about?
The formal trial that's on fall prevention is the one in the Ames Community Center and in the Story City Fitness Center.
So that's the one at 1:30.
Yeah.
And then
And
the one at Faulkner.
The Forker is at 10, and that's kind of our general Walk with Ease program that is it'll be led purely by students, so it won't be by Peggy. And we kind of use that as a general program for anyone in the community that might not be at risk of falling. So if a person qualifies and is at risk of falling by their doctor or by a physical therapist, then you would be eligible for the trial.
And that's at the Ames.
Yes.
And that's at the Ames.
So there might be a waiting list because we've had a lot of people that are signing up, but we'd love to we'll be doing this for 3 years. So don't feel like you're going to miss out if it takes you until like March or April to sign up. We'll try to get as many people through as we can, but there are some people that are kind of ready to go, so we can't take people like immediately. But sign up and then we'll get you on our program.
All right, one last opportunity for questions. All right, well, thank you so much, Dr. Wells, and thank you.
Yeah, pleasure, and I really appreciate all your great questions and interest. So it's more than I could have expected. So thank you.
Well, thank you everyone for coming out today. Want to remind you, our next programs are coming out for February and March. You'll get a flyer in the mail maybe later this week or early next week. I'll also email them with a link to go to our website to sign up. Just so you know, Tuesday, February 7th, one of our cardiac rehab nurses is doing a program on heart health for older adults. Or she named it something, Heart Healthy Living. And then Wednesday, February 15th, is a program Putting Out the Fire, Prevention and Treatment of Gastroesophageal Reflux Disease. So, thank you, everyone. Thank you for joining us. Thank you, everyone online, and we'll see you here hopefully in a couple weeks.
You guys have somebody